Good morning, everyone. Thank you for joining us. We'll just be waiting until 10:30 to kick off the event while everyone logs in and joins the event. Good morning, everyone. Thank you for joining us. We'll just give it another minute or two for everyone to join us. But thank you so much for joining us on this lovely morning. We'll get started in a minute.
Good morning. Wherever we are meeting on First Nations land. I am on Ngunnawal country. I acknowledge the traditional owners of all lands. I acknowledge the continuing culture and contribution First Nations people make to the health and safety of country. I pay my respects to elders past and present, and I acknowledge all Aboriginal and Torres Strait Islanders joining us today. Aboriginal and Torres Strait Islander people have lived here for over 20,000 years, navigating this often difficult climate. This has required great knowledge of the environment, skillful custodianship, and close cooperation. For tens of thousands of years, First Nations people have cared for country and for one another. We can learn from the teachings of First Nation people to help us navigate, cooperate, and address the challenges we face today. Thank you for joining us for this important event. I hope that wherever you are joining us from, you and your family are keeping well during this strange time. My name is Jacqueline Agius. I am the ACT's Work Health and Safety Commissioner. Today, I'm very proud to launch the strategy for managing work-related psychosocial hazards. It is both deliberate and fitting that I am launching our strategy in National Safe Work Month. The theme for National Safe Work Month this year is Think Safe, Work Safe, and Be Safe. This month is a time to commit to building safe and healthy workplaces. Being healthy and safe means being free from physical and psychological harm. No job should be unsafe, and no death or injury is acceptable. This strategy is the first of its kind in the ACT and is the product of the efforts of dedicated WorkSafe ACT inspectors and staff members who are here today. I want to extend a huge thank you to those who have brought my vision to life. I would like to thank the entire WorkSafe team for making this event possible, and especially the Work Health and Safety Deputy Commissioner, Amanda Gray, Dr Peta Miller, Jackie Shepherd, Dawn Nixon, Brooke Gray, Jasmine Walker, Michelle Robinson, Adelaide Haynes, Ben Palmer, Joe Jaycock, and Jeff Beaver. My vision for workplaces in the ACT is this. I believe that every Canberran has the right to be safe at work, both physically and psychologically. This is a basic right, and duty holders, mainly persons conducting a business or undertaking, should be held to account to ensure this right is provided to each and every one of us when working. Despite these obligations, it is evident that PCBUs are not effectively managing work-related psychosocial hazards. Psychosocial hazards are hazards that arise from or in relation to the design or management of work, the working environment or equipment, or workplace interactions or behaviours. These may cause psychological and/or physical harm. Psychosocial hazards can cover a broad spectrum and may include bullying, traumatic events, lack of role clarity, workload pressures, poor physical environment, poor support, remote or isolated work, harassment, including sexual harassment, and violence and aggression. This strategy demonstrates WorkSafe's commitment to improving the management of these hazards. The strategy will guide our initiatives and activities over the next 3 years to meet our key objectives. Increasing awareness of how to identify and manage psychosocial hazards and what true and sustainable compliance looks like. Supporting compliance through promoting and developing materials for priority industries, small businesses, and protecting at-risk work groups. Proactive enforcement and prioritising psychosocial hazard complaints and notifiable incidents. And building our own capacity and capability to effectively play our part in improving worker outcomes. The risk of harm from all psychosocial hazards is immense. On average, work-related psychological injuries have longer recovery times, higher costs, and require more time away from work. We aim to protect all workers from these harms, and I am particularly passionate about preventing work-related violence and aggression. In Australia, from 2017 to 2018, there were 1,130 claims to exposure to workplace violence, and twice as many of these claims being made by women compared to men. In the ACT, since 2017, we have seen 292 accepted claims linked to violence and assault in the private sector. Yet, despite this, we know that there is significant underreporting. If we cannot understand the size of the problem, we can't fix it, and it can lead to an acceptance of work-related violence as part of the job or too hard to manage. Each year, in all different types of workplaces, workers are exposed to psychosocial and physical hazards when they are assaulted or harassed by clients, colleagues, and members of the public. These workers may be medical and support staff, aged care and disability support workers, teachers, hospitality workers, public servants, transport workers, sex workers, retail workers, or hairdressers. These workers have a few things in common. They often identify as women, they deal with people, they often have low control over their work, they are often in precarious or insecure working environments, and sadly, they are often subject to violence and aggression, which may result in injury or death. It is inexcusable that workers such as women, those who identify as LGBTIQA+, those from culturally and linguistically diverse backgrounds, young workers, people with disabilities, and those in the casual workforce are bearing the burden of poor management and unsafe systems of work. Our strategy and the plan which sits under it to target work-related violence and aggression is an important step in preventing significant harm. Based on our data, we have prioritised the following industries: aged and disability care services, education and training, particularly preschool and school education, and medical and other care services. We have also prioritised action to address the culture of underreporting for both work-related violence and aggression, and in a separate plan, sexual harassment. Sexual harassment is unlawful, and recent events have only highlighted the pervasiveness of sexual harassment in our society. In her review of the model work health and safety laws in 2018, Mari Boland called for model regulations to ensure the effective regulation of psychosocial hazards. These issues have been highlighted as requiring priority action by all work health and safety regulators and Safe Work Australia for some time. WorkSafe's Strategic Plan 2020 to 2024 and our Statement of Operational Intent 2020 highlighted our commitment to addressing psychosocial hazards, and indeed reflected the Minister and the Work Health and Safety Council's expectations. The COVID-19 pandemic and subsequent lockdowns have demonstrated the urgency to act to manage work-related psychosocial hazards. Our strategy is the framework to guide action, to build understanding and awareness of workplace obligations, to ensure PCBUs are appropriately addressing risk, assessing risk, and implementing control measures and safe systems of work, to ensure incidents are reported if they occur, to assist in the development of a mature and sophisticated workforce that addresses psychosocial hazards in the same way as it addresses physical hazards. I look forward to partnering with you all to achieve these goals. The resulting health and safety outcomes are immeasurable and will demonstrate that the Territory is an Australian leader in the prevention and management of psychosocial harm. I want you to hear directly from our team of psychosocial inspectors, who are going to provide more information on psychosocial hazards and risks, what to expect when psychosocial inspector calls, and what an inspection that targets psychosocial hazard entails. I am also very pleased that we are joined by Dr Peta Miller, who will share some preliminary findings from a project she is undertaking for us on barriers and enablers. We will conclude today with a Q&A, and I encourage you to put your questions into the chat link in WebEx. I am now going to hand over to Senior Inspector Jeff Beaver, who will move through the psychosocial team's priorities and give you a detailed insight into our work. Thank you for joining us this morning.
Good morning, everyone. My name is Jeff Beaver. I'm currently the Acting Senior Inspector in WorkSafe ACT's Psychosocial team. The Psychosocial team consists of dedicated inspectors whose primary role is dealing with hazard complaints regarding allegations of adverse workplace behaviours. This team also focuses on educating workplaces in psychosocial risks and recommending certain training or education packages that may assist industries in managing this type of employment risk, which includes work-related violence and aggression. The purpose of the Whs Laws is to eliminate or minimise risks to the health and safety of workers. Health is defined as meaning psychological as well as physical health. The Whs Laws set out specific duties to manage risks to psychological health and safety. It is important to remember a person may have more than one duty and more than one person can have that same duty. A person controlling a business or undertaking, commonly referred to as a PCBU, has the primary duty to ensure, so far as reasonably practicable, workers and other people are not exposed to psychological health and safety risks arising from the business or undertaking. This duty requires you to manage risks to psychological health and safety arising from the business or undertaking by eliminating exposure to psychosocial hazards so far as is reasonably practicable. If it is not reasonably practical to eliminate them, you must then minimise those risks so far as is reasonably practicable. Workers have a duty to take reasonable care for their own health and safety and to not adversely affect the health and safety of other persons. Workers must comply with reasonable instructions as far as reasonably able and cooperate with reasonable health and safety policies or procedures that have been notified to those workers. A person's mental health is not a fixed state of mind. It can fluctuate depending on the environment the person is in. And regarding workplaces, this includes factors such as employee interactions, management and supervision, front of house and conflict. Mental, psychological health, just like physical health, is an important part of work health and safety. Understanding and managing risks in the workplace that may lead to physical or psychological injury creates a safe, healthy and productive workplace. Occasionally, a seemingly minor incident can have a long-term impact on a worker's psychological and physical health. This can be due to a build-up of negative experience or other factors which are not immediately clear. These reactions may include physical signs like headaches, insomnia, indigestion, high blood pressure, or a loss of appetite. There are also emotional factors such as irritability, lack of concentration, anxiety, depression, loss of confidence, or low morale. Other reactions may include behavioural signs such as poor work performance, accidents, poor relationships at home and work, dependence on tobacco, drugs and alcohol. Psychological hazards that can negatively impact on a worker include things like work-related stress, work-related bullying, fatigue, and work-related violence and aggression. Psychological injuries typically require 3 times more time off work than other injuries. Workplace violence and aggression can be an incident where a person is abused, threatened, or assaulted in circumstances relating to their work. Workplace violence and aggression may include such things as physical assault, such as biting or scratching, hitting, kicking, pushing, grabbing, throwing objects, intentionally coughing or spitting on someone, sexual assault or another form of indecent or physical contact, or even harassment or aggression behaviour or aggressive behaviour that creates a fear of violence, such as stalking, verbal threats and abuse, yelling and swearing, by phone, email or online or in person. Workplace violence and aggression can result from a range of sources, including external violence and aggression from customers, clients or members of the public, internal violence and aggression from other workers, supervisors or managers, and family and domestic violence from a family or domestic relationship when this occurs at the workplace, including if the person's workplace is their home. Workplace violence and aggression can result in both physical and or psychological harm to the person it is directed at and anyone witnessing that behaviour. The Office is an independent entity established by the Act which supports the regulator to administer the Territory's work health and safety related legislation by providing information, advice and support, as well as compliance and enforcement activities to ensure safe, fair, productive working lives for Canberrans. The Office has the overarching function of education, research and awareness raising. Specifically, the Office's responsibilities include to promote an understanding and acceptance of and compliance with this Act or other Territory laws relating to work health and safety, to undertake research and develop educational and other programs for the purposes of promoting work health and safety, to advise the Minister on any matter relevant to the operation of a Territory law under which the Commissioner performs a function, and also any other function given to the Office under this Act or another Territory law under which the Office performs a function. WorkSafe ACT values the partnerships it has established to enable all workplace parties to take responsibility and lead a culture of change at work. WorkSafe ACT's roles incorporates not only a compliance and enforcement function in relation to work-related violence and aggression, it also includes ensuring fair and firm enforcement action against non-compliance and minimising physical and psychological harm, and by educating improvements in WHS practices and culture. Next slide. There are, however, some things that WorkSafe ACT cannot do. These include, we can't provide legal advice, mediate between the workplace parties involved, provide counselling, order the employer or business to discipline the alleged bully or terminate their employment. We cannot take sides. We cannot deal with industrial matters or discrimination. And also, we cannot issue an order to stop bullying behaviour. The Fair Work Commission has powers to issue these orders if required. In cases where any of those things cross over with a psychosocial matter, WorkSafe ACT inspectors will advise the associated parties of other avenues and or government organisations they may wish to contact to assist in those other areas. There are tools out there that can assist workplaces to identify psychosocial hazards in the workplace. For example, the People at Work tool is a psychosocial risk assessment survey tool that provides benchmarking that measures psychosocial hazards and factors in your workplace. It is Australia's only free, validated, and evidence-based psychosocial risk assessment survey tool. People at Work can help your workplace comply with your health and safety duties, better manage work-related psychosocial hazards and factors, and prevent psychological harm. More information about PAW is available at our website. One thing an employer can do to help comply with their work health and safety obligations is access the People at Work tool. All workers have the right to be safe at work. Workplace violence is an incident where someone is abused, threatened, or assaulted in any circumstances relating to their work. It covers a wide range of behaviours that can be a risk to the health and safety of workers. It can be one unexpected incident or a series of repeated incidents. The most common is aggression and verbal abuse. Work-related violence and aggression is not just a police matter. It is also a matter that directly relates to work health and safety. Workplace violence may not always begin in a critical or extreme situation. It sometimes follows a pattern of escalating behaviour, from agitation, expressed anger or frustration, and intimidating body language to verbal abuse and threats, physical threats, or assault. A risk assessment for workplace violence should be carried out by the person conducting the business or undertaking. If a workplace violence is a risk at your workplace, don't wait for an incident to happen. Instead, understand the risk, implement control measures, and provide a way for workers to report all forms of workplace violence. A person conducting a business or undertaking must have safe systems of work to identify, report, manage, and support workers who could be or who have been subjected to work-related violence or aggression. It is also important to understand that a workplace can be somewhere other than the usual place of work if you have workers working from home and working off-site. As the PCBU, you must continue to manage all WHS risks, including family and domestic violence. Safe Work Australia has a guide on preventing workplace violence and aggression that outlines the process of identifying and managing the risks. In the absence of a safe systems of work, a workplace concern escalation process and/or a procedure for dealing with work-related violence or aggression, a PCBU would be seen as not complying with their primary duty of care to their employees. Next slide. Workplaces can play an important role in preventing and responding to family and domestic violence by providing a safe working environment for all workers. In some cases, workplaces can be a refuge for workers experiencing family and domestic violence, and the workplace can provide critical social and economic support. The Australian Human Rights Commission provides guidance about how to communicate that family and domestic violence is a workplace issue. Safe Work Australia also has an information sheet about managing the risks of family and domestic violence, including how to support workers who are working from home. Managers and colleagues can greatly enhance recovery after an incident. During and immediately after an incident, the survivor, including witnesses, need to know they have support. This may include such things as first aid and/or medical assessment, flexible working arrangements, and informal social support from colleagues and managers. A person can complete an online psychosocial hazard complaint form, which can be easily found on WorkSafe ACT's website. Once completed, that information will be allocated to one of the designated psychosocial inspectors, who will then contact the complainant and commence assessing their information. Additionally, a PCBU can make contact with WorkSafe ACT via phone or email to request a psychosocial inspector, give them a call to discuss any issues or concerns. I'll now hand over to Inspector Joanne Geacock. Thank you.
Sorry, I've just unmuted. My name's Joanne Jaycock. I'm one of the psychosocial inspectors, and I'll be providing an overview of what to expect when a psychosocial inspector calls. A psychosocial inspection is an inquiry-driven process. Depending on the matter that's been looked at by the inspector, multiple workplace inspections may be conducted to look at how the PCBU is managing psychosocial risks. An inspector, through the interview process with managers and with workers and HSRs if they're present, and through review of PCBU documentation, will gather information on the psychosocial hazard sources and risks and how they may be interacting, and the controls being implemented by the PCBU. Once the necessary information is collected, an analysis is undertaken to identify contraventions of the Act, and where appropriate, enforcement notices are issued. So the next slide shows that the psychosocial environment is a complex system and is interactive. Inspectors will inquire on psychosocial risks that are present at the workplace and will consider the whole environment, the system, including any interaction of psychosocial hazards that could increase the risk of psychological harm or injury. There could be multiple contributory hazards and risk factors that lead to a risk event or incident, which then results in a psychological or physical injury or harm. If we consider the construction industry, we know that workers are routinely exposed to ever-changing and highly physically demanding conditions, such as manual tasks, vibration, heat, poor lighting, etc. In addition to that, they could be experiencing fatigue from job overload, working irregular schedules, working long hours to meet tight deadlines. The feelings of stress can be viewed as a response to the psychological, emotional, cognitive, and physiological aspects of a worker's job. If stress levels continue to rise, workers' mental health can be affected, as well as their job performance, but it also can have impact on on safety culture. For example, failure of a worker to follow safe work practices could be due to a lack of supervision by their supervisor, which could flow on from lack of the supervisor's responsibilities in supervising their workers. They could also be experiencing job overload, and also there could be time pressures on the supervisor. These psychosocial factors will compound together, increasing everyone's stress levels and increase the likelihood of unsafe work behaviours. So I'll go to the next slide. So one of the aspects that the psychosocial inspector will also look at is how the PCBU is tackling psychosocial risks at their source, that is at the hazard level, to most effectively control the risk of psychological harm and injury. It's not dissimilar to what happens in the physical realm, where addressing the hazard source is considered to be more effective in controlling risks. Broadly, psychosocial hazards can be categorised into the design and management of work, social factors such as interpersonal relationships, leadership, organisational work group structure, etc. And also the hazardous environment, equipment and task factors. Each workplace is unique and there is not a one-size-fits-all. So the inspectors really do drill down into the PCBU situation and their range of relevant hazards and risk factors. So we're just going to look at an example of occupational violence and the psychosocial hazards that could be identified when an inspector undertakes an inspection. So there are also physical environment hazards that would be considered in this setting. So the setting is an education setting which has complex needs students attending programs. So the physical environment hazards that would be looked at by the inspector would include poor access and egress, availability of objects that could be used to injure, lack of visibility, and unauthorised access to vulnerable areas, which can be attributed to a poor layout and poor design. Some of the psychosocial hazards that the inspector would also look at would include a weak and permissive management and reporting practices, where violence and low-grade aggression is normalised, working in isolation, where there's a lack of supervision, training and resources in managing complex needs students, inconsistent or team conflicts in recognising occupational violence and aggression, having continued exposure to student interactions with inadequate downtime, inadequate emergency preparedness and response, inadequate post-incident support processes, including return to work. It's important to note that these psychosocial hazards can undermine a worker's confidence in the PCBU's management of occupational violence, and this can increase their stress levels. The PCBU will need to demonstrate to the inspector that it has implemented risk controls so far as reasonably practicable. For example, if a PCBU has only implemented a lower order control, such as training, where a high order control is reasonable and available, and all knowledge of these are known or should be known, then this could be considered a contravention of the Act. In addition to controls for the risk event itself, ongoing monitoring of the effectiveness of control forms part of the continuing risk management cycle, and this will also be looked at by the inspector. So it's not a set and forget process, it is something that needs to be ongoing. Due to the uniqueness of each workplace, involvement and consultation with workers underpins effective risk management, in addition to it being a legislative obligation which the inspector will look at. Given the complexity of psychosocial risks, multiple controls, a mix of systems, and people working together, fulfilling their roles and responsibilities will be needed. Go to the next slide. So going back to the occupational violence example, for this scenario, multiple controls addressing the physical work environment and how work is designed are high-level controls, and these will be considered by the inspector to determine whether the threshold of so far is reasonably practicable has been met. So some examples include having clear access and egress, and ensuring that obstacles to staff evacuation, escape are removed, that weapons of opportunity are risk assessed to determine whether the objects need to be secured, access points to selected work areas being limited, improved lighting and visibility of work, colleagues, work areas and access points, work systems that remove or reduce working in isolation, a risk-based approach to determining student entry and placement, teaching schedules and programs and staffing ratios. Improving attitudes towards managing and reporting occupational violence and aggression so that there's consistency, and also staff training across cross-cultural awareness, mental health issues, broader situational and security awareness, interpersonal communication strategies, de-escalation techniques, emergency procedures, etc. So these are some of the common notices that inspectors will use to secure compliance. The notice most likely to be used by a psychosocial inspector is an improvement notice. A prohibition notice could also be issued. Depending on the seriousness of the matter, the psychosocial inspector may initiate an investigation process which could result in a prosecution or enforceable undertaking. Go to the next slide. We'll just go back to the occupational violence scenario. I've got a couple of improvement notice examples of actions that could be required of a PCBU where a breach has been identified. In the improvement notice, we will identify the section of the Act that has been contravened. So I've got an example against Section 19A and Section 19G of the Act. So in relation to Section 19A, the PCBU is, so far as is reasonably practicable, required to remove secure objects that could be used as a weapon and remove obstructions to egress in their educational program areas to ensure a safe work environment for workers who are at risk of injury from occupational violence and aggression. Under Section G, the PCBU is required to implement, so far as is reasonably practicable, an incident reporting register capturing all incidents of occupational violence and aggression with clear roles and responsibilities for the purposes of ensuring workplace conditions are being monitored to prevent illness or injury of workers. So in relation to these improvement notice examples, the inspector would undertake a follow-up workplace inspection to verify that the improvement notice has been complied with, and would also undertake a desktop review. So thank you very much for listening, and I'll now pass over to Ben Palmer, who will be presenting next.
Great. Thanks very much, Joanne. Hi everyone, my name is Ben. I'm also one of the psychosocial inspectors at WorkSafe ACT, and I'm just going to be covering off iAuditor and the at WorkSafe ACT and the psychosocial maturity indication tool. Okay, so the recent implementation of iAuditor has brought with it some exciting and progressive benefits for WorkSafe ACT. The application has allowed for open for pen and paper audit programs and checklists to be digitalized for the use on laptops, iPads and phones, making the applications highly versatile for the inspectorate. The IORDER application will be utilised by the entire inspectorate, which enables more oversight and better trend identification across the different inspectorate teams. This is going to allow for more efficient monitoring, notification and attention of inspectorate-specific issues. The linking of information through the platform's digital information collection and analysis will reduce the admin burdens on inspectors to allow more attention to be placed on the inspections of the workplaces. So what this means is that our inspectors will have more time out in the community and better inspection efficiencies. The IORDER platform is going to assist WorkSafe through a range of inspectorate applications, including the development, coordination, conduct and live monitoring of proactive campaigns and industry-focused inspections. The results and analytical application of IORDER will provide each inspectorate with an insight into each industry's status when it comes to work health and safety compliance. The platform is going to allow for efficiencies, identification and highlighting of repeat offenders and at-risk industries and workplaces in ACT. What this means is that there'll be less places to hide for those workplaces who are repeat offenders and the increased issuing of regulatory action for non-compliance. In conjunction with the introduction of IORDER, the Psychosocial Inspectorate is also developing a new psychosocial maturity indication tool. This maturity indication tool is going to allow a number of things. Firstly, it's going to increase the inspectorate's reach when it comes to psychosocial inspections. So we can do more inspections in the psychosocial space. It's going to allow WorkSafe to gain a more in-depth understanding of current maturity levels of industry and ACT workplaces. It's going to allow the Psychosocial Inspectorate to focus on the more at-risk industries and workplaces to reduce those work-related psychological injuries. It's going to allow the maturity indicator utilises responses from both employer and worker representatives to gain a holistic view of the workplace's maturity status. And that data and insight provided by the maturity indicator will also inform WorkSafe's future direction when it comes to psychosocial compliance. And also the results from the psychosocial maturity indicator will also provide targeted feedback and resources to the workplaces on ways that they can improve psychosocial compliance to prevent and reduce the risk of psychological injury to their workers. The maturity indicator will also provide workplaces with that feedback and education, along with key resources to improve compliance. So this will assist workplaces to begin improving their workplaces based on their maturity indication score. Industries and workplaces who are indicating or identifying the potential for increased psychosocial risk will be likely to have a follow-up inspection by one of the psychosocial inspectors. While industries and workplaces who are indicating that they have low psychosocial risks will also receive feedback and information on how they can continue to improve towards a best practice standard. The Psychosocial Maturity Indicator tool will also be looking at 3 particular indications, and that's attitude, capability, and compliance. It's the combination of these 3 indicators that will be used to generate an overall maturity score. And so by gaining an indication of maturity and monitoring workplace trends over time, WorkSafe will be able to provide the right approach to workplaces to ensure that workplaces are psychologically safe places for people to work. Thanks very much.
I think it's my turn. So, good morning, and I acknowledge that I'm on Ngunnawal country speaking to you today. So the first point I wanted to make was that you've already heard from our inspectors and from Jackie. So some of the barriers I'm going to talk about, they've already told you how you can start to approach them. But I wanted to first tell you that about this project. So WorkSafe ACT knows that organisations and the community are concerned that there's poor management currently of psychosocial hazards at work. So as Jackie referred, they've commissioned a project which I've got the privilege of leading, and in terms of to provide them with summarise de-identifying information on duty holders' views and attitudes. How duty holders in the ACT are currently managing their psychosocial hazards. What are their perceptions of their own organisational maturity to manage these issues? What are they finding are the big barriers for them in terms of when they're trying to comply with work health and safety requirements? And what duty holders, unions, industry associations and WHS professionals think WorkSafe ACT need to do to provide duty holders with better guidance. So importantly, the outcomes of these consultations will inform WorkSafe's 2022 activities. So I'm just going to present to you some of the insights from both the research literature and some of the preliminary interviews that we've held with ACT stakeholders to date. So can I have the next slide? Thanks. So unacceptably high numbers of Australians, worryingly over 11%, report high levels of psychological distress due to work. We see from this data that women, young workers, and those in precarious employment, and those with low job control and low skill use, these are known psychosocial hazards, are most at risk. Professor Tony LaMontagne claims that job strain from his work can be attributed to 13% of depression in men, working men across Australia, and 17% of women. This is sort of terrible and is not acceptable. But really worryingly for me, this estimation that he provides doesn't even include other work-related mental disorders such as anxiety or post-traumatic stress, etc. So the data is very, very clear. We need to do much better. So the research and stakeholders tell us, I'll have the next slide, thanks, tell us that there are a range of triggers that encourage organisations that it's time to take action. And I apologise for my voice quality, but we'll just go on with it. A little too much speaking I've been doing later. So we know that some of the common triggers, both from the literature and the interviews we're doing so far, is compliance or enforcement action, such as an improvement notice from an inspector. Often it's when a psychological injury occurrence has occurred. Less commonly, unfortunately, it's when there's been a proactive action taken by the organisation to do risk assessment, do a survey or consult with their workers. Increasingly, we're finding that it's the financial pressures. Organisations will have looked at their organisational costs, the cost of insurance, workers' compensation and premiums. And increasingly we're seeing that there are contractual supply chain partners or even investors that are wanting proof that organisations are managing the psychosocial hazards better. We know that there are shared duties, and so duty holders are going, well, you know, what's my obligation to stop workers being assaulted or unreasonable workload pressures? And a positive motivation is the understanding by more mature organisations that you can actually reduce errors, increase innovation, reduce wastage, so you can actually have positive benefits. We know that leadership change is also a common motivation for change. And the legislative reviews that are going on are kind of focusing everybody's minds a little more on what we're hearing. We hear that organisations want to do better, and but I think it's interesting as the behavioural insights and regulation researchers say, when the nudging and pushing duty holders, that's persuading them using rational arguments about why it's good for business and using incentives like partners saying, look, I'll give you more business if you do the right thing, isn't working, we need to shove. And that is firmly and fairly enforcing the WHS requirements around managing psychological risks. Most organisations tell us they want a level playing field, and when they're making the effort, others should be too. So I expect that those are the upcoming regulations on psychological health and safety and code of practice, and then the enforcement action by regulators such as WorkSafe ACT will be a trigger for much more decisive action. So if I could just have a next slide, please. So we know that stigma, a major barrier is stigma and discrimination around poor mental health, whether it's work-related or non-work related, and this is a very serious barrier. And we can see some of the data on stigma and on mental health in the workplace. And we will be providing these slides for you as resources. Next slide, please. So what we know is very clearly duty holders, despite the incredible range of materials that WorkSafe ACT and other regulators, and Safe Work Australia, Beyond Blue, SANE and others, the Workplace Mental Health Alliance have. It's great information about that. They tell us that they remain confused about what are the minimum requirements they must do to meet their duties. They're particularly confused around where there's shared duty holders, and I mentioned that in terms of those who are up and down supply chain. Think about the duties in terms of whether when governments like the National Disability Agency actually are providing contracts and suppliers in the ACT who are delivering care to individuals who need additional care support. Where are the boundaries? And they're concerned about how to juggle the actual and the perceived conflicts around work health and safety, privacy and anti-discrimination requirements, and what are reasonable adjustments in particular circumstances. It's important that our listeners kind of remember that WorkSafe ACT themselves, industry associations, unions, and certified WHS professionals and legal professionals can help provide clarity around those overlaps. We know that there are significant organisational level barriers, and that's illustrated on the next slide. Thanks very much. So the literature is really clear that some of the most potent barriers are perceived and actual financial business pressures and actual resources and lack of resources to implement psychosocial controls. Sometimes this is because organisations don't understand the real costs and benefits around implementing effective controls, and that they're not often as complicated as they think. We can't avoid the reality that there are some workplaces that have complex and inherently high-risk work activities in terms of psychological health and safety. We can think of the Education Centre. One of the inspectors was talking about those settings that providing help and support for children with high and complex needs, or the police, or ambulance workers, those in the prison sector. That doesn't mean they can't and they shouldn't do something about it. We also know that there's issues where managers themselves have high workloads and stress, and often they just feel they have very little spare emotional and mental energy to deal with the psychosocial risks adequately and distressed workers. We know that immature organisational cultures, and Ben, in talking about the I Auditor program that WorkSafe has done, and so this is an Australian first, so well done on that particular initiative, is looking at compliance. They're also looking at cultural maturity aspects. So we know that low levels of organisational maturity and a poor culture are really important barriers to organisational change. We know that if there's a lack of senior management commitment to the issue, and organisations, despite what they publicly are saying, are prioritising profits or customers over work health and safety, the psychosocial issues will not be effectively managed. The literature and, in fact, the interviews mean that we're worried about organisations that have a fatalistic belief, for example, that preventing psychological harm in their workplaces, in their circumstances and line of work is just not realistic and it's too expensive to change. It won't cut it. We've heard from the inspectors, it's not a reasonable excuse. We should be concerned where there's explicit or implicit blame cultures that are present, one which tries, and this is illegal, to transfer responsibility for managing psychosocial hazards or risks to workers. It is the employer, the PCBU, who has the control over the design and the management of work, and they hold the responsibilities. In the next slide, we're talking about some of the other barriers that are around what I've grouped as organisational and individual awareness, knowledge and skills. I've talked about that complacency and fatalistic attitudes, but we also know the really serious one is cognitive bias. This is, where organisations are underestimating the real psychosocial risks and the consequences. Not going to happen in my workplace. I've got everything under control, and our workplaces are safer than they actually are. So we find that optimism bias and hindsight bias are very serious barriers to managing these issues. And we often hear that the sheer volume of materials about what is relevant and what they could use is kind of overwhelming. So I'll be interested in seeing what initiatives such as the National Workplace Mental Health Initiative can do to help provide employers with more targeted advice. And finally, we know that the effective work health and safety systems, which I've got in the next slide, are actually required to manage the critical psychosocial hazards and risks. And that's a message that I like our listeners to take home, is that if you look at the material that's out there, you could see that there's a range of common psychosocial hazards and risks. I urge you, look at the critical ones. Look at the ones that are most significant to your organisations. As our inspectors have already told us, no workplace is the same. So you will need to talk to your workers about what's going on in your workplaces. But we can hear from our stakeholders and the literature that poor business cases where people are not actually looking, they're only looking at the prevention costs. They're not actually adequately counting all the significant benefits to the organisation if they actually manage work health and safety and psychological health and safety appropriately. And I urge you to have a look at the O'Neill publication on the Safe Work Australia website for some tips. And in fact, Safe Work New South Wales have got some a fact sheet on it that's quite useful. So we know a major barrier is where work health and safety business cases and business cases for workplace mental health are not integrated into the overall business risk management, and that there's inadequate reactive processes rather than proactive. They're waiting till an incident is occurring rather than actually proactively looking out for what's going on. Repeatedly, the literature tells us, and we know this from our consultations, that there is an over-reliance on lower order controls. Training and policies and procedures are examples. I can tell you quite clearly that from my conversations with all the regulators across Australia, including WorkSafe, they won't cut it. If you're just relying on policies and procedures and training your workers when the inspector comes to visit, you're likely to be issued a notice. And we also know that organisations have got poor processes for allowing equitable access to mental health systems. So can I just have the final slide? So what we've been hearing so far, thanks, is this is our preliminary comments from our stakeholders in terms of what they would like from WorkSafe ACT in the future, and Jackie and her team have been listening to this advice, are in the slides. So we're hearing that there's some, that they really want some targeted compliance support and targeted visits, and they want a fair enforcement of non-compliance, that level playing field. There's some really useful suggestions that I've got on the page, including a better business cases for psychosocial hazards management and how they can do. And we'll be working with WorkSafe ACT and others to unpack some of those. So that's a little snapshot of what we've been hearing today. Look out in 2022 for an invitation that's coming to all of those who've tuned in, and will be on the WorkSafe website and LinkedIn, for how you can provide some additional insights on what do you think are the important barriers to ACT duty holders to comply with psychosocial hazard risk management, and how WorkSafe ACT can help. And of course, you can contact me directly if you'd like some more information. So I believe now we may be opening up for some panel questions.
Yes, good morning. Thank you for joining us. My name is Brooke Gray. I'm a Senior Director for Investigations and Psychosocial. I'd like to thank our Commissioner, Jackie Agius, and our speakers, Peta Miller, Joanne Geacock, Ben Palmer and Jeff Beaver, who are participating this morning. We have a few questions that have come through to chat, and I think the first question is directed to the Commissioner. New South Wales have a code in this space, and there is talk of a national psychosocial risk code of practice. Are WorkSafe ACT looking at a code in the interim?
We are working towards a code in the ACT. So at the moment, we have looked at what New South Wales are doing. Of course, Queensland have one in draft. Western Australia also looking at a code, and Safe Work Australia have begun their work towards developing a code. Our Minister has prioritised the code of practice, and that our WorkSafe Industrial Relations section are currently working towards developing that code for the ACT. I've been calling for a code since I began my role in April last year, and from my perspective, it can't come soon enough. So as soon as we're able to get it happening, and some of the work that Peta Miller is doing, of course, is to consult with our stakeholders so that we're aware of what our stakeholders need as part of the development of that code. Thank you for your question.
Thank you. We have a question for you, Ben. It's about the Psychosocial Maturity Indicator tool, and this is from Sarah. Is the completion of the Psychosocial Maturity Indicator tool a requirement for all organisations to complete? And who is required to complete? WHS/HR personnel or whole of organisation?
Yeah, so it's definitely not a mandatory requirement for any businesses. It's going to be utilised by the inspectors when they're out inspecting a workplace, and this could be construction, retail, across any of the industries. And this is just a tool that we can utilise to get an indication of the current psychosocial maturity of the workplace. We'll probably look to try and get somebody in a senior role as a representative for the employer parts of the questions, and then a worker potentially in a HSR role or something similar to get a perspective from the worker side to get that holistic overview. And that's sort of how it's going to be sort of applied. And it's not a regulatory tool, it's just an indication piece that we can use for further inspection, and also give that industry a bit of an indication as to where they're sitting and how they can improve on different areas.
Great, thanks, Ben. The next question is from Karen, and it's directed, I think, to the Acting Senior Inspector, Jeff Beaver. Will inspections be undertaken in response to an incident or randomly?
That's a very good question. Actually, both. So what you've seen at the beginning with Jackie's presentation was we've got some certain target industries which we have concerns about, especially in relation to occupational violence and aggression. But our inspection regime will also include reactive and proactive work. So for both occasions. So it may well be that there is no incident, but you still find an inspector coming and knocking on the door just to have a bit of a chat about psychosocial risks and hazards, but also in response to an incident. So both.
Okay, thanks, Jeff. The next question I'll open up to the panel. What does WorkSafe ACT see as the biggest psychosocial hazard in Canberra workplaces? Perhaps some of the inspectors.
Oh, that's a really good question.
Yeah.
Look, I'm happy to start. I'd start that the biggest risk, psychosocial risk, is not knowing that there is a psychosocial risk or a psychosocial hazard in your workplace. Because if we don't know that there is a hazard, we can't risk manage it. And that is, you know, in relation to all work health and safety matters. I can see Peter is nodding, so I'm sure Peter will have something to add there.
So, Jackie, I think that's an excellent point you've made, because there's plenty of information around what are the common hazards, and we can see the outcomes in terms of injury and bullying and violence, but in fact it's the combination of hazards that interact together to create the risk of harm. So I think that's, I might use that in some of my future speeches, Jackie. I think that's exactly it. The biggest risk is not actually asking your worker, not taking a proactive approach to actually identify what's happening in your workplace.
Great, thank you. The next question is from Joe, and I think I'll hand that over to Jeff. If an employer has responsibility for managing home environments regarding psychosocial hazards, how can we effectively manage this around privacy considerations and what people may be willing or not willing to share about the home environment?
Yeah, it is always a very tricky situation, especially with the way that the COVID has developed and how we've moved our workplaces more into our homes. And privacy is an issue as well. I think from a psychosocial inspector and WorkSafe's perspective, if something was to occur in the workplace in relation to psychosocial risks or hazards, what the inspectors would look at is basically what have you done to try and address those issues? Have you tried to stay communicating with your employees? Have you approached them? Have you offered them support? Are there networks in place? It's not just a matter of setting and forgetting. So the employees at home, they've got a screen, let's forget about them and they'll do their job. It's still about following up and touching base. You know, little things like daily welfare checks, just a 5-minute chat. And if WorkSafe can see that, you know, you've done everything that is reasonably practical to stay engaged with that employee, then that obviously is a factor that we'll consider in relation to any incident that may occur at home. So, a good question.
Great, thank you very much. Now, this is as from an employer, and I'll send it to you, Jeff, again. As an employer, if I ring WorkSafe with questions, will that mean I end up getting audited?
No, not necessarily. No, it may well be. Part of WorkSafe ACT's armory is education. We encourage employers, if they identify an issue that they think that may be emerging in their workplace, we strongly encourage them to get in contact with us. It may well be that we can send them some resources, some advice, maybe even just go and have a chat. So it wouldn't be an audit, just go and have a chat to the business about what may or may not be occurring in the workplace. Because as has been raised, it may well be that, you know, there's in some industries there's a very high culture of underreporting, and if an employer feels that there are things going on in their workplace and people aren't telling them, their employees aren't telling them what's going on, and they want advice, of course we're just going to come and give them that advice.
Great, thank you. The next question is deals with occupational violence, and I think I'll throw this to the Commissioner. If something violent happens to me at work, do I contact the police or WorkSafe?
Well, I would say that you contact both, but it depends what the incident is. And if, for instance, it is a notifiable incident under our legislation, then your employer is required to notify us. And a notifiable incident is a serious injury where you may end up in hospital. You should also contact the police because it could be a criminal offence, and that really is a matter for you to determine whether or not you would like to make a statement. But the very first thing that you need to do is to let your employer know. So if there is a violent incident, you should let your employer know, and they should be able to provide you with information on what the next steps are and how to address the matter, including calling the police.
Great, thank you very much, Commissioner. The next question is from Karen, and I think I'll throw this to the inspectors. How do we know what compliance means? What are we measuring against? Ben, can I have yourself to answer that?
Sure. Yeah, good question. as we touched on as well, it goes off the hierarchy of controls. So what we're looking at is to make sure that you have, so far as is reasonably practical, applied the right level of controls to the hazard. Each situation is quite different, and that's why it's very hard to give very specific examples of compliance. But if you're assessing a risk and then using that hierarchy of controls to mitigate and manage those risks, then you're more likely to be sitting in that sort of area of compliance. So, and the other thing I would say as well is when if an inspector comes to visit, it's actually a positive for workplaces. What we're there to do is to try and identify any gaps in your current processes in the workplace, because what we want to do is to ensure that the workplace is a place that is free or has everything in place to reduce risks and hazards to their workers. We want the best outcomes for the workers and the employers. So it's quite a positive if you get an inspection from WorkSafe looking at the psychosocial hazards and risks, because we can help you identify any gaps you have.
Great, thank you. We've got one more question, and this is from Megan. What if I'm a casual and the boss is aggressively bullying me? If I contact WorkSafe, I'll just get to the sack when they start asking questions. Jeff, can I throw that one to you?
Yeah, that's a great scenario, and it's actually unfortunately not a very uncommon one. What WorkSafe ACT and myself and our team would strongly suggest you do is you get in contact with us. Okay, if there's issues in relation to you're concerned about your employment relationship, by giving us that information, we can talk you through that. There have been occasions when we've been able to conduct inquiries and investigations with a confidential complainant, so not actually identifying the issue. What we do in those sort of cases, if we feel that there's something going on in the workplace and the person doesn't want to risk their employment, they can give us the information, we can keep it confidential, and then we can just turn up to the business and just do a general audit, a psychosocial audit on what controls are in place. So there are different ways in which we can help to address the issue. So please don't feel that just because you might lose your employment that you can't contact WorkSafe. We have many different ways in which we can go about things, and to keep your information confidential.
Great, thank you. The next question relates to sexual violence. Given that some victims of sexual violence in the workplace may not feel comfortable going to hospital, what is being done to still trigger an inspection at the workplace? Jeff, can you take that one as the acting senior inspector?
Yeah, I think it's a hard one, because and best to address. My strong suggestion would be that where there has been any type of occupational violence or aggression in the workplace that you have been subject to as an employee, one, contact police. Okay. Secondly, contact WorkSafe. Okay, it's very important, and we understand at WorkSafe, especially as do ACT policing, the sensitivities around this type of violence, and it will be a matter treated in the utmost of confidentiality, taking into account what the complainant wishes to do in relation to the matter. WorkSafe ACT has a designated victim liaison officer, which can walk you through processes in relation to how things may proceed. So my strong advice would be in those sort of situations is contact police and also contact WorkSafe, because we do have, like I've said before, there are several ways in which we can approach these issues, and your confidentiality, especially in those sort of situations, is at our utmost importance.
Could I just add to that, Brooke?
Certainly, Commissioner.
Thank you. There are times when victims of sexual violence do not feel comfortable reporting the incident to the police, and that is always respected by WorkSafe ACT. If a victim of sexual violence would like to make a report to WorkSafe ACT, we can treat that incident with confidentiality, and we can organise to go into the workplace and inspect the workplace in a way that doesn't identify the victim if the victim wishes to remain anonymous. And Jeff was referring to the fact that we can run processes confidentially, but also Jeff referred to the fact that we respect the wishes of the victim and will not disclose any information that the victim does not wish us to disclose.
Thank you. The next question's for the psychosocial inspectors, Ben and Joanne. And this is about compliance support suggestions. How would you manage the careful balance of providing support and guidance while also remaining within the boundaries of an appointed inspector? Ben, would you like that one?
Can you say that question again? Because I think it had
certainly.
2 parts.
Yeah,
Sorry.
how would you manage the careful balance of providing support and guidance while also remaining within the boundaries of an appointed inspector?
Yeah, no, that's a good question. I suppose as an inspector, we're looking at and we have a role as a regulator to, if a breach is identified, then regulatory compliance action will be taken. As Joanne pointed out as well, a lot of our regulatory action that will be likely to be taken in the psychosocial space is an improvement notice. So, as if there is a breach or if there's something that's non-compliant, that improvement notice is going to come with direction and recommendations. So, I suppose if you're looking at the whole action as a package, it will have an educational piece in there. We're also not going to just sort of issue a notice and leave you to work with it. If you do need that assistance, the inspectors, we're all here to assist you and support you in providing you with resources and information and guidance so that you can meet that compliance. Because at the end of the day, just like you, we want to make sure that workplace is safe. So there's both the regulatory side and the educational side. I don't know if you want to add anything else, Joanne?
Yeah, I just wanted to add, I think maybe you're also asking about support and guidance for a person who has had an incident occur against them. And I guess we're not psychologists, although Ben, is training to be one. So we are very careful about advice that would be considered to be clinical advice. That's not our role or responsibility. We work within the Act. So the main thing is that the person, if there is a concern for that person, that we would direct that person or give guidance to that person to actually go and see their GP or to contact EAP if the PCBU has EAP. So yeah, we are careful about what sort of support and guidance we can give to a person who's put in a complaint.
Great, thanks, Joanne. Ben, this is about the eye auditor. The psychosocial maturity tool, how was it developed, or was it an existing tool that has been tailored?
No, so it's been developed from a couple of existing tools. So it's sort of pulling together. It's an adaptation from the People at Work questionnaires and also the mentally healthier workplace questionnaires. And then in conjunction with internal external stakeholders, it's been sort of pulled together based on sort of research around the maturity indicators that I mentioned before. It's been developed to sort of pull together all of those factors to generate a maturity indication. And that's sort of why as well that it's not a regulatory piece, it's an indication tool for the inspectors to use. Great,
thank you. Our last question, and this is directed to anyone on the panel. With COVID-19 lockdowns, what trends have you witnessed relating to psychosocial hazards? Shall we start with you, Jeff?
Yeah, certainly. Probably one of the most interesting trends that we've seen, which is actually more of a concerning trend, is a bit of a downward spike, a downward trend in reporting. So we've been working very closely and watching very closely what industry's been doing, obviously in regards to the easing of restrictions, as to what effects that may have as people start returning back to their workplaces. It may well be something that the restrictions have allowed for a bit of a stopgap measure for any issues that were occurring in the workplace at the time. But of course, once people start returning to work, whether those issues then come to the surface again. But yeah, I think just to really harp on a point which has come across in messaging across this whole presentation, that still says to WorkSafe ACT underreporting. Like what is really happening out there, and we really need to get a grip on that. I'm not too sure, Ben. Ben or Joanne, have you got anything more to add to that?
Yeah, I think you pretty much nailed it. But the only other thing I'd probably say is there's probably been a reduced level of monitoring now that people aren't in the offices. So this is also where resources like For People at Work are fantastic, where you can still monitor your workforce while they're maybe not so much in the office and interacting. But I suppose the monitoring side's probably dropped off a little bit as well, just because people aren't there and present in the office.
Great, thank you very much. That was our last.
Can I add one more? Oh, sorry, Brooke.
Sorry, Jackie.
One more, and one of the other trends that we've seen, of course, is isolation and people being isolated and detached from their workforce, and that can create a psychosocial hazard for some people. Brooke, there was another question here that I think we may have...
Jackie, can I just throw something in before we go to the next one? I just want to, because I'm an independent person here, throw an alarm out, is that what I'm hearing is people were prepared to really put up with a lot whilst COVID was on and we were all struggling with the pandemic. What I'm hearing is the claims will increase for MSD and psych once people go back, because now they're saying, okay, the crisis is over. Now I've got a whole lot of that built up pressure and issues. And if workplaces don't get on top of managing the psychosocial hazards when people get back, they're likely to have a rise in claims, I think, from the built up stress and the cumulative pressures that people have been under whilst working under these extraordinary times. So get onto it now.
Because it's also that fear, isn't it, Peter, of contracting the virus once people go back to the workplace, that can cause that a psychosocial hazard as well. So people really need to make sure that they have safe systems of work in place to manage the virus, in order to manage the psychosocial hazard that comes along with that. It's from Amanda Day, actually, and it just says that, are there any specific psychosocial safety related WorkSafe ACT award categories, any case we can engage executive with? And we don't have any specific awards, although we do sponsor some awards. For instance, we sponsor MBA awards. We also sponsor a Master Plumbers Safety Award. But what I would say, and you've kind of answered your own question, Amanda, and you've said apart from productivity benefits, I think that, and this is probably not a bad place to end, and I know Brooke's just going to wrap things up. I think the benefit of healthy and happy workers to an organisation can never be underestimated, and that in itself should be enough for people in organisations to want to manage this, because we can't underestimate healthy and happy workplaces and the impact that that has on the overall ACT community. Because when people are unhappy and unhealthy in their workplaces, they take that home, and that spreads throughout our community. So by making sure that we manage psychosocial hazards, we're doing a service to the ACT community. We're keeping people in our community safe. And I know that everyone at WorkSafe is really proud of the work that we do to contribute to the safety of the ACT community.
Great, thank you very much. Now that's a wrap for this morning's session. I'd just like to thank all the attendees who joined us on this virtual on launch of our psychosocial strategy. Our strategies will be on our website shortly, and we'll look forward to working with every one of you on this important topic. So thank you very much for attending, and have a great day. Thank you.
Thanks, Brooke. Bye.
Bye.